Okay, then we have also here the epithelial tissues. So they just differ, all our epithelial tissues here just differ with one another, with their significance, with their origin. For the first one, we have your squamous epithelial tissues. Okay, the squamous epithelial tissues here considered here to be the largest urinary sediments, and we use this one as a basis for focusing or knowing here that we are on the correct dimension with our urinary sediments. So pag nakita mo na ang ating squamous epithelial tissues, eventually mean to say you are on the right plane already. Okay, so it is the largest and most likely the nucleus of this one would as big as the size of our RBC. Okay, so increased concentration of your squamous epithelial tissue here would try to obscure the microscopic identification of your other sediments, which are too small, which could eventually be overlapped here with our squamous epithelial tissues. And therefore, we need to make sure here that your squamous epithelial tissue here should be reduced, okay, by preventing here the contamination of this one. Okay, by the best way to collect the sample here is through your midstream clean catch na specimen. Okay, so your squamous epithelial tissues try to originate in the following area in our body. So for the female, it try to line here the vagina, it try to line here the female urethra, and even the lower portion of the male urethra. And the presence of your squamous epithelial tissue here is of no clinical significance. Okay, and hindi siya significant. Okay, basically it just represent here the normal slugging of the cells. So mean to say, most likely either hindi ka nag-collect ng midstream clean catch or hindi ka nagpunas ng kanyang genitalia ang ating patient. Okay, and then again, a problem with that, hindi siya significant, but then again, pag madami ang squamous epithelial tissues natin, it might obscure with your microscopic identification, especially for those cellular constituents natin which are small, like RBC or even your WBC, which are more significant kasi natatakpan niya. Okay, so however here, in some condition, we could also identify abnormal or pathological na squamous epithelial tissues in the form of your clue cells. Okay, your clue cells here usually being produced in a patient with the Gardnerella vaginalis infection. It's a sexually transmitted infection. Your clue cells identified as your squamous epithelial tissues in which the entire area, o itong squamous mo, entire surface niya is being covered. Okay, this one is the nucleus. Entire surface being covered by the bacteria or even extending beyond here, meron pa rin mga bacteria. If you happen to identify the presence of your glue cells, all you need to do here is to perform your vaginal wet mount preparation. So I mean to say you try to get vaginal secretions from the patient and try to perform here the wet mount preparation for identification of your glue cells. Okay, the next one, epithelial tissues, we have here the transitional epithelial tissue, also called here as your urothelial. So this is the type of your epithelial tissue which try to originate in the renal pelvis, calyces, ureter, bladder, or even the upper portion of the male urethra. So this one here comes in different forms or shapes: spherical, mean to say round, polyhedral, and we have also here the caudate. Polyspherical here, the round, would resemble here our renal tubular epithelial tissue, the next na epithelial tissue na discuss natin, which could be found here in your distal convoluted tubules, is also round. So differentiation here is with the location of their nucleus. If this one's transitional, ang kanyang nucleus usually is centrally located. Pero pag RT, renal tubular epithelial tissue, ang kanyang nucleus is eccentric. Okay, so increased concentration of your transitional epithelial tissues here found in single clamps, or you call this one as your syncpesia, signifies urologic procedures. Okay, so urologic procedures like like for example, naglagay ka ng catheter sa patient, so it might result here for the formation or would have here the presence of your transitional epithelial tissues. But in some cases, your transitional epithelial tissues here having this one irregular nuclei and the presence of the vacuoles. This one, those are the abnormal na transitional epithelial tissues, and that would relate here to your malignancy or cancer. Okay, so most likely ang ating transitional epithelial tissue here is much more of the pathologic siya. But if you have just your squamous epithelia, so squamous epithelia is non-pathologic talaga ito. Not unless is occlusals. Okay, the third epithelial tissue we have here, the renal tubular epithelial tissue. So, renal tubular epithelial tissue here from the word itself, it tried to originate in the renal tubules. So, medyo nasa paloob na siya. Okay, so kanina, di ba, pag squamous epithelial lang, nasa baba, tapos pataas, transitional, and nasa kidney na natin, so mga renal tubules na natin, so that's your renal tubular epithelial tissue. So this could be originating here in your proximal convoluted tubules. In the proximal convoluted tubule, this is the renal tubular epithelial tissue, which appears to be columnar and convoluted because it's trying to assume here the shape of your renal tubules. On the other hand, the one found here in the distal convoluted tubule appears to be round or oval, which resemble our spherical na transitional epithelial tissue. And again, it could be differentiated from one another by the, again, ang ating transitional epithelial tissue would have here the centrally located na nucleus, whereas your RTE found in your distal convoluted tubule will have your eccentric na nucleus. Another one, RTE found here, originating from your collecting ducts, appears to be cuboidal and never round the shape. And this one usually appears in groups of 3 or more. And you call that one as your renal fragments, or you call this one as your large sheets of your cells. So basically the RTE, so significant, it becomes significant here if you have more than 2 per HPF. Okay, so increased RTE since nasa renal tubule siya, it would signify a damage in your renal tubules. So that's invasive or toxic ito na condition, and that's related to your acute tubular necrosis. And damage to your renal tubules, it might be because of the following: exposure to your toxic chemicals or heavy metal poisoning, salicylate poisoning, the presence of your hemoglobinuria, myoglobinuria, that all eventually try to result here to the damage with your renal tubules. Okay, then we have also here the property of your renal tubular epithelial tissue. It can absorb different substances found in our filtrate. It can absorb here your bilirubin. So those are patients having the liver problem, it could absorb here the bilirubin, and that will have here appears to be deep yellow na color. Another one, it could also absorb here the hemoglobin found in patients with your hemoglobinuria, which eventually become your hemosiderin granules, and that could be identified here by your Prussian blue and appearing to be blue in color if you stain that one. Another one, the RT can also absorb here your fats. One is absorber fats, magiging oval fat bodies na siya. So we define here your oval fat bodies as your RTE, which absorb your fats. Okay, and basically this one could be seen here in increased fats or lipids. You call the condition here as your lipiduria. That may be seen in your nephrotic syndrome, in your diabetes, or even because of the leakage of your bone marrow or your marrow fats in the case of your damage in your bone marrow. Okay, true lipiduria would be associated here with the presence of your oval fat bodies plus your free-floating na fats. In the case of your contamination, so free-floating fats lang, mean to say nasa taas. Kasi yung free-floating fats, usually nakikita naman natin sa upper surface ng ating urine, di ba, you have your free-floating fats, and that would signify here contamination. Like in the case, for example, the patient would have here because of the vaginal preparations, because gumamit siya ng vaginal creams, lubricants, and I don't know for what purpose. Okay, another one, you could also have here your bubble cells. So bubble cells here are just your RTE, which is non-lipid filled vacuoles. And this become here bubble cells, para siyang bubbles, di ba, parang nag-dilate. because it's just represent here the injured cell in which the endoplasmic reticulum here try to dilate prior to the cell death of that. Okay, so again, among our all epithelial tissue here, pinaka-pathologic would be your RTE. That's why normally dapat wala tayong RTE present. Again, for the squamous epithelial tissue, our reporting for that is, again, semi-quantitative per LPF. Transitional is semi-quantitative per HPF. Your RTE is average number per HPF. Your oval fat body is also average number per HPF. Okay, so the next cellular sediments here would be your bacteria. Okay, normally our urine do not have here the bacteria. Okay, so significance the bacteria would eventually be related to your true bacterial infection. That's in the case of your cystitis. Pag sinabing cystitis, that's the lower genitourinary tract na urinary tract infection. So, nasa bladder, urethra, okay, nasa baba. Pag nasa taas na siya, that's your pyelonephritis. Okay, so basically, a true bacterial infection is identified here by the presence of your bacteria plus meron siyang WBC dapat. On the other hand, what you have only here is only the bacteria lang. It might be related only to your contamination. So contamination because of your unpreserved na specimen, not able to process or not able to deliver the specimen immediately to the laboratory where the bacteria tend to multiply. So you would able to know here that that one is unpreserved na specimen by checking for the pH. Again, if the pH more than 8, then mean to say that one is unpreserved ang specimen. That would signify that the specimen is unpreserved and that would require the patient to recollect the sample. Okay, the best way, so again, your bacteria could be confused with your amorphous substance, yung mga granules natin. Or even, we could also, like in the case of your bacterial cast versus your granular cast, so almost na pareho sila. And they could be differentiated here by your gram stain. So gram stain would help us then to identify that one is your bacteria. Kung pag bacterial cast, it will give a positive result for the gram stain. Pag granular cast, hindi siya magpa-positive. The same way, kung granular siya like amorphous substance versus your bacteria, pag bacteria, gumagalaw naman ang bacteria natin eh. So gram stain, positive ang bacteria, negative ang ating granular or yung mga amorphous substance. Okay, next one, we have here the yeast. Yeast here is just your spores. Ganon. Usually, try to buds off. It just signify here a fungal infection. Sometimes, mycelia is mycelia. Okay, mycelia here nagbabranch. So, hindi siya bilog-bilog. This your mycelia na tinatawag. It still signify here, related pa din siya with your fungal infection. So, the true fungal infection is associated with diabetic patient. Okay, why? Because ang high glucose environment here would allows, that's the ideal medium here for the growth of your fungi. Another one, bacterial infection or yeast infection here, the presence of that could signify also the presence among not only in the diabetic patient but immunocompromised or even in the patients with the vaginal moniliasis, which is a sexually transmitted disease. On the other hand, pag through yeast infection, pag through infection, meron kang yeast cells, meron ka rin dapat na WBC. But what you have only here is your yeast cells, so that would signify your contamination, so mean to say that's in the case of your unpreserved na specimen. And then we have also here your parasites.